Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Tuesday, December 22nd. We are joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpreter, Mary Thiessen, and André Boursier from French Language Services Directorate are also with us today. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@gov.yk.ca. ecoinfo@gov.yk.ca. Premier Silver?
Thank you very much, Pat. Thank you, everybody, for joining us today on the traditional territory of the Kwantlen First Nation and the Ta'an Quechan Council. I'm very pleased to be here with Mary and with Dr. Hanley for our final update of 2020. It has been a long and challenging year for everybody. Before I begin, I would just like to acknowledge what has happened in the past week. We're very deeply saddened to hear about the tragic loss of the long-term Marsh Lake residents, Percy Andrews and Joanne Smith. We are sending our condolences and sympathies to their families and friends and to the entire community of Marsh Lake. I also want to share my condolences with our neighbours in Nunavut, who just recently announced their first deaths related to COVID-19. Our thoughts go out to your families and to your friends as well. Events in Nunavut have shown a very stark way how serious this situation and the virus is. It can spread incredibly quickly, and we are all vulnerable. We remain in the grip of this pandemic, and we cannot let our guard down. Now that solstice has passed, the days are once again growing longer. I think that we can all look towards a brighter future. With Christmas only days away, I wanted to once again remind Yukoners about hosting guests this holiday season. Whether it's students returning home from university or grandparents who may otherwise spend the season alone. I know many of you want to share a meal, share a hug with your guests. Now, Dr. Hanley and his team have provided guidance so that you can host your guests and share an intimate visit with them as long as you self-isolate with them. This means following all of the regular self-isolation rules by staying home, only going outside alone, or with people you are self-isolating with, and not having others to visit. If your guests leave before 14 days, your entire household will need to continue to self-isolate for 3 days following their departure and self-monitor for symptoms. After 3 days, if no one in your household has symptoms, and your departed guests do not have any symptoms either, you are free to leave your self-isolation. Now, we've been getting questions. Why only 3 days? These guidelines are recommended by Dr. Hanley and have been developed based upon science. People with COVID-19 may be infectious for up to 3 days before they start exhibiting symptoms. So, if your guest leaves and develops symptoms within those 3 days, they could have been spreading COVID-19 to you and the rest of your household. When this is the case, you and everyone in your household must continue to self-isolate for the full 14 days from your guest's departure. However, if your guests does not develop symptoms within 3 days of leaving, that means that they were not infectious while in Yukon, and you may carry on with your day-to-day life. If you are hosting someone from out of the territory but do not want to self-isolate with your guest, well then you must follow the self-isolation option 2 guidelines on yukon.ca. These include staying 2 meters or 6 feet or 1 caribou apart from anyone self-isolating in your household, using a separate bathroom if possible, washing your hands often, and cleaning household items regularly. We are confident that these self-isolation options will allow Yukoners to connect with their loved ones for the holiday season while still keeping our communities safe from COVID-19. Even if you are not hosting guests over the holidays, I cannot stress enough the importance of practicing the Safe 6+1. I know you've heard me say this before, and I'm going to say it again, and I'm going to continue to say it. The best things that Yukoners can do to prevent the virus from spreading and to keep yourself safe is to practice the Safe 6. Washing your hands. maintaining physical distancing, staying home if you're sick, traveling responsibly and respectfully, and self-isolating as required, and following the guidelines, the gathering guidelines that are in place, limiting indoor gatherings to 10 people. And of course, masking up when you're in public. I do want to thank everyone for wearing masks this month. I miss seeing people smiling. We were watching people smiling with their eyes nowadays, but it is great to see people masking up to protect themselves and their fellow Yukoners. The Safe 6+1 are so very important right now because vaccines are not coming yet, but they're coming. So it's the gift that we can give everybody over the holiday season is to wear the masks. We need to do our best to keep the virus at bay while we wait for the vaccines to be approved and to be rolled out. And again, we are not out of the woods yet, and now is the time for us to dig deep. I know that the holidays will be very difficult this year because we are not gathering like we normally do. But the last thing we want to do is to have a breakout of cases in the coming weeks just as vaccines start to arrive. So I'm asking all Yukoners, again, please, be very extra careful over the holidays and do your part like you have been for the last 9 months to help prevent the spread of COVID-19. I can't thank you all enough for all of your vigilance, and we're almost there, folks. This includes practicing the Safe 6+1, but also checking in on your friends and your neighbors. These continue to be very challenging times, and we need to take care of each other. The efforts that you put in now will be more than worth it when we start rolling out the vaccine. We are still waiting for the approval of the vaccine of Moderna by Health Canada, but we can anticipate that it will be approved this month. We continue to plan the rollout of the vaccine, guided by the vaccine strategy that we released on December the 10th. We have been preparing for the delivery of the vaccine, which could be a mere 48 hours after approval. We recently participated in a dry run of the vaccine delivery. Whitehorse was selected as one of 5 sites nationally to test the delivery system of the Moderna vaccine from Europe to its final destinations. The intent of the dry one was to validate and confirm the shipping, the tracking, the monitoring, warehousing, and onward movement of vaccine capabilities in order to deliver vaccines to remote areas in Canada. It was also intended to confirm that the National Operations Centre established to coordinate the logistics and distribution of the vaccines in Canada was prepared for the ordering, tracking process as well, specific to Moderna. It also confirmed that the 5 selected sites were ready to receive Moderna vaccine shipments. The test shipment left Europe on December 15th and arrived by air in Whitehorse on December 17th. It was then delivered under RCMP escort to our vaccine depot, where it was found to be in good shape, with no damage, and that the cold chain of 20 degrees below had been maintained. The other locations for the dry run are Yellowknife, Northwest Territories, Inuvik in Nunavut, High Level in Alberta, and also Corner Brook, Newfoundland. I want to thank everyone involved for this planning exercise. We are well prepared here in the Territory to receive the vaccine when it becomes available. If you have not seen it already, you can find the vaccine strategy on yukon.ca, as well as other information on our government's response to COVID-19. I want to end by saying Merry Christmas and Happy Holidays to you all. I wish every single one of you the happiness of this season and the wonders of a year to come. No pressure 2021, but we're all looking forward to a better year. I believe that we can all put a lot of hope into that. So I'll end today before passing it off to Dr. Hanley by saying what I've been saying for 9 months now. Be kind to each other. Be excellent to each other. Have an excellent holiday season. And here's to 2021. Dr. Hanley.
Thank you, Premier. Here. Good morning. Bonjour. Tout le monde. For my update, I'm going to focus on a few points. I'm going to, again, go over the holidays and what we should remember for the upcoming holidays. I want to just advise of the hours for the CTAC and drive-through testing centres over the holidays. And lastly, I want to mention an update regarding the vaccines. After a few weeks of uncertainty, I'm happy to say that we have no active cases within Yukon. Our last case, number 59, has been recovered as of today. And we have officially gone a week without a new case and with no further evidence of community transmission. I'm sure this is welcome news for all of us as we enter into the holidays. Yesterday, as the Premier said, was another turning point as we turned the corner on solstice, the longest night of the year, in a time where, with morning darkness, the nights have seemed so long already. The darkness can be hard for many of us, particularly when we're living in such a stressful moment. But as of today, we can all welcome the return of the light. Light as a metaphor for our COVID journey is in all our conversations. We have almost reached a year since COVID made its first appearance in North America, 9 months since it reached Yukon. And it's an important time to reflect for all of us. With the vaccine rollout quickly approaching, there is a sense of hope and optimism that I feel has returned to the community. And although there are undoubtedly yet more twists and turns in this story, I do believe we are at the beginning of the end of a long journey. As the Moderna vaccine awaits its final sign-off from Health Canada, just last week, as the Premier detailed, we had our first dry run of a vaccine delivery, and that's another important preparatory step completed. Our teams have been dedicating themselves to ensuring success with the vaccine strategy, and each day we become more prepared for the arrival of vaccines in Yukon. 2021 will start off positively as vaccines arrive and as we continue preparations to get vaccines into the arms of as many people as possible. And these efforts will also bring light back into everyone's lives. I want to take this time to remind you that all of our efforts have not been lost. We're seeing another monumental moment in history unfold. And after this is all said and done, I'm sure that Yukon will come out stronger than ever. Well, I've said that 2021 should start off positively, and I hope it will, on one condition, that all Yukoners remember to stay safe over the holidays. As everyone finalizes their holiday plans and finishes baking or decorating, deep emotions may be setting in. The reality of our different Christmas is finally coming home to all of us. Whether it is not being able to welcome friends to our tables or not being able to see family members that we cherish. For some of us, this may be a first Christmas without children or without parents. The holidays will be hard for many Yukoners this year, and my heart goes out to all that have had to sacrifice plans and trips home to see their families. I count myself very lucky that my family is here, and I'm incredibly grateful to have them with me during this time of year. However, I know that many people, teachers, students studying out of territory, people separated from their families, parents, grandparents, children, extended family, healthcare workers, many others are unable either to travel out or receive family home, perhaps for the first time. I know many of you have had to make very difficult decisions leading up to the holidays. One more sacrifice for the sake of all Yukoners. I want to thank you all for keeping the interest of our Yukon communities in mind. We've had to rally together this year, and with vaccines around the corner, we need to continue to hold out. We must consider our neighbors, our elders, and our colleagues before making decisions that could easily affect the lives of those around us. So for all of you who are going into the holiday season with drastically altered plans, holding much smaller festivities than normal, or celebrating with your loved ones via Zoom, I want to acknowledge and appreciate the efforts you're making. I also hope that during the holidays, whether the time you get to take off is a few hours or a few days, please make the most of your time and take the opportunity for a break from COVID-19. The constant cycle of COVID-19 news has been emotionally draining on all of us. Disconnecting from COVID-19 and taking a step back from refreshing the case count every day can allow you to reset and truly enjoy a break over the holidays. Whether COVID or other news and events, it feels we are being bombarded daily, and the pace has been exhausting. I do hope that each of you can take some time to disconnect, get outside for a walk, read that book that's been on your bedside table for months, reconnect virtually with friends in other areas, or begin watching a new movie or series. Take some time that is for you and do something that will help you relax. Enjoy this time as we all deserve a rest. Of course, taking a break doesn't mean avoiding or foregoing any of the public health measures in place. We still need to follow actively the Safe 6+1 to ensure that when we quietly ring in New Year, we are able to move forward with confidence. We could be smug about how well we're doing in Yukon, but only 3 weeks ago we were perched on the edge of community spread and wondering how hard COVID might hit us. Now the rest of the country and much of the world is currently struggling under the weight of rampant COVID spread. We mourn with our friends in Nunavut for those who have died. Most of the country is now under some form of lockdown or restriction. So let the lessons of our recent encounter with COVID linger on. We know that the transmission of COVID-19 thrives in indoor settings when any number of people gather. If we opt to disregard the guidelines and have a New Year's party or gather for a white elephant gift exchange, we could easily find ourselves back where we were, or much worse. It is so easy, once we are out of trouble, to be lulled into comfort, security, and complacency. But we never know when COVID-19 will quickly enter back into our lives. COVID could easily be here, just waiting for any opportunity to spread. The Safe 6+1 is in these times an integral part of our lives. And let's review, perhaps for the last time this year. Number 1, keeping your distance. If you see people who are not within your social bubble, always maintain that 6 feet apart. Avoid large holiday gatherings, and see yukon.ca for further details on our updated holiday guidelines for gatherings. Number 2, keep your hands clean. Wash your hands frequently and use hand sanitizer when soap and water are not handy. 3, if you're feeling sick, stay home. Don't attend any holiday gatherings, either outside or inside, and don't go to work. Stay home until you arrange for testing and your symptoms have resolved. Remember to use the self-assessment for advice on testing and use the traffic light posters to guide you. Number 4, keep your social bubble small and consistent. Remember, only 10 people are allowed in an indoor space. Don't change your social bubble over the holidays. And check the new guidance on the website for keeping your bubbles faithful over the holiday period. Number 5, if you're traveling, do so respectfully. This applies to travel to communities within Yukon, but it also applies to travel outside Yukon should it be necessary for you to do that. And make sure you review whatever restrictions are in place prior to traveling to other parts of Canada. Number 6, self-isolate when necessary. Again, that's if you're ill, stay home and self-isolate. If you have traveled, be prepared upon your return to self-isolate. And remembering, as the Premier once more detailed, we have 2 options for self-isolation if you are hosting incoming guests. During the next few days, there will be some closures because of the holidays of the SeaTac and drive-through. And we anticipate that demand for testing will likely be lower over the days of Christmas and Boxing Day, and in light of that, the COVID Testing Assessment Centre and drive-through will be closed on December 25th and 26th, and both assessment centres will reopen after that. But we're always ready to test when necessary. If you are having symptoms and wish to be seen on either of those days, please visit the emergency room at the Whitehorse General Hospital. Rural health centres will be available, as always, for emergency consultation if necessary. Use the 811 or the self-assessment online to get testing advice ahead of time. And please call first if you wish to be seen by the nurse at the health centre. Our COVID info line will also be on pause temporarily between the dates of December 25th and 29th. Please keep in mind that our staff have been working tirelessly and are all in need of some time to rest and reset before heading into 2021. So remembering, in summary, if you can, do your best to relax and rest and even turn off for a while over the holidays. Take a break, especially from COVID. Remember that bubbles must stay small. Visit the website for any more advice on how to keep your bubble safe. Avoid any indoor gatherings apart from your bubble and keep all outdoor gatherings safe. Always remember the Safe 6+1 using your mask. That's all for my update, and thank you, and remember to take care of each other and to stay well. Merry Christmas and happy holidays to everyone. Merci, Masicho. Thank you. Gonastish.
I'd like to thank the Premier and Dr. Hanley, and we'll go now to the phone lines. We'll begin with Stephanie, Yukon News.
Yes, you mentioned the dry run for the vaccine arrival. I'm wondering if you can talk a little bit about what's being done in communities outside of Whitehorse to prepare.
So I can begin. I don't know if you want to add anything to that as well, Dr. Hanley. So with the dry run, it was really an exercise in getting vaccine to Yukon. And as far as what we're doing to make sure that communities prepare, as we get the vaccine delivered, we do have on yukon.ca our vaccine distribution plan. We've had Minister Frost and others talk about the teams that will be sent out into the rural communities to make sure that every community from Old Crow to Watson Lake outside of Whitehorse has access to the vaccine. Also, we talked about the preparation for our one-stop shop here in Whitehorse. So all the details on how we distribute the vaccine once it gets delivered is available on that vaccine distribution plan on yukon.ca.
Yeah, thanks, and I will echo the Premier's comments and also say that there will be more details to come once we're into the new year in terms of exactly how that rollout will happen. And again, one of the advantages of the Moderna vaccine, unlike the Pfizer vaccine, is that it does allow us to have a centralized depot once we get the Moderna vaccine at Whitehorse, which is the much preferable model, so that the shipment the shipment for Yukon will come into Whitehorse and be stored in a centralized location. So and then the distribution will be with the mobile teams out to the communities. So Moderna really lends itself to that model. So in terms of community preparation, it's on the one side, definitely it's preparing our teams, and that's with going over the logistics, having all the supplies in place, the people, the training, all of those measures over the next few weeks are in that preparation phase. And on the community side, we will be working with communities as a whole and also one by one to prepare communities and the people for the arrival of those mobile teams, once for the first dose and again for the second dose. So so it's critical that when the teams are there in the communities, that we're ready on the provider side and that the communities and the people are ready to go to receive the vaccine in those hours or days that the mobile teams are there.
Thank you. Stephanie, do you have a follow-up?
I don't, thank you.
Thank you. We'll move to Luke from CKRW.
No questions from me. Thank you.
Thank you. To Philippe from CBC Yukon.
Yes, thank you. I wonder, will there be any kind of perhaps a sticker or bracelet or some kind of public show that people have received a vaccine? And is that useful?
It's a really good question, and it's a question again that we're considering at a national level as well as individually. So there will likely be some kind of documentation, but we're actually really working out what the potential role of that will be, because of course with anything there are opportunities for misuse of the documentation. And really our primary goal is to get the population immunized. So as many people in the population immunized as possible within a reasonable period of time is our goal to achieve that goal of population immunity. So that really is the goal. So in terms of how that applies to the individual in terms of certification, it's I would say at this point we're looking at those options and any policy around that might be useful. It's a really good question, and we just don't have all the answers yet.
That's good.
Philip, do you have a follow-up question?
Yes, I do. Thank you. How does it affect things that children are not covered by this vaccine? Do you have any sense that a timeline on testing for children, how that would happen? How does that affect the total coverage of the vaccine if children are not covered?
Yeah, again, it's we're going to as we get further along, we will understand more about the applicability of the vaccine products for children, with some of the further iterations of the phase 3 trials. They will start to include children. Already there is planning for going down to age 12. I think that's for the Pfizer product, but it's for one of the two anyway. So there are sort of expanded planning to include younger people in ongoing clinical trials. Of course, the children are frankly not the priority right now. So the priority is the adult population, because that is where we're seeing disease transmission, and that's where we're seeing serious disease. So even globally, we really the overwhelming priority is to protect our adult populations. Of course, it's not to say we're forgetting about our children. It's just that we've got time to work that out. If we were in a scenario of say adult population immunity, and we had not yet had vaccine available for children, we would be in a really good position. And then we would be working out there are all kinds of protocols to work out in terms of how do the public measures still apply when you have an immunized population, and included within that will be how do we treat and test children. But we will be in a situation where the transmission potential within the community should be far, far lower.
Thank you. We'll move now to Tim from Whitehorse Star.
Yes, good morning. Thank you. My question is for Dr. Hanley, and for the Premier for that matter. Considering we've gone a week without cases and there are no active cases, are we at a point where you could almost functionally say that COVID is currently eliminated in the territory again?
Well, I will start with
You
that.
start. Yeah.
I would never go that far. I'm hoping that we get to the point where we can say that. I would not be surprised if there are cases within Yukon that we have, for one reason or another, have not recognized. And I think that's the assumption we always need to be working under. So again, if there are cases within Yukon, the important thing is that ideally that we know about them through testing, but more importantly is that we prevent onward transmission. So really the goal is, again, individual cases don't worry me a lot. It's when cases are in settings where you can have transmission, which can turn a case into a cluster into an outbreak into community spread. Those are the things that I do not like to see. So no, I think it would be premature to say that we've eliminated that as an ultimate goal. But what I can say with confidence is that we continue in containment mode, and that we have no evidence of community transmission of COVID.
Yeah, I would just add that the amount of cases currently in Yukon is just one variable of many variables that we have to maintain vigilance on. There's two other things moving forward. One is the travel of folks over the holidays. That we saw in the States and in Canada after Thanksgivings. Spikes in cases in the past. So that's something that we're monitoring. Also, once we start getting vaccines into arms, what will be the public's participation, but also attitudes towards where we are in COVID. One of the biggest things you're hearing nationally and internationally is, from the medical community is a real concern that, the first few vaccines happen and people go, oh, we're done with this and we can now turn the page. And that's just not so. So those are other variables that we have to consider as well when we take a consideration of time and place, COVID, Yukon, and where we are in our phases moving back to normal.
Thank you. Tim, do you have a follow-up?
Yes, I do. It's a related question. Just playing devil's advocate here. So at what point could we say that COVID is eradicated here in the territory? What evidence would you need?
I'll go to Dr. Hanley for that recommendation.
I actually don't think we will. I mean, based on what we know so far about COVID, I don't think we will realistically ever eradicate COVID-19 from the territory. I think what will happen if we have a successful immunization both in Yukon and around the country and around the world is that it will become an endemic. It will go from pandemic to epidemic to endemic. And what endemic means is it's still around, but at kind of a low-lying level, and might, depending on mutations, depending on evolving population susceptibility based on the vaccine success long term. It may be something that continues to hit us in waves. It may be something that becomes kind of like another influenza, a seasonal virus. Clearly, this virus is worse or has more capacity to affect us in winter season. So I think it'll turn into kind of a seasonal virus, likely, and I doubt very much that we will eradicate this disease. The only proviso is that it came out of nowhere. We have seen with coronavirus, basically with the SARS-1, that it basically did disappear. But this is a very different virus in terms of its transmissibility. So I think more realistic is that it will turn into an endemic disease.
Thank you. We'll move now to Clariane, Radio-Canada.
Oui, c'est possible de me raconter en français, donc, cette répétition de la livraison du vaccin, comment ça s'est passé? Et je me pose la question aussi s'il va y avoir de répétition ici au Yukon pour les collectivités rurales.
So could you please repeat in French how the dry run for the delivery of the vaccine happened in the Yukon and how it will be done with rural communities?
Oui, donc la practice, l'arrivée du modèle vaccin, c'était pas le vrai vaccin, mais quelque chose qui était entretenu à la température prescrite, qui était le -20. Donc c'était un trajet depuis Europe jusqu'à Whitehorse. Et donc c'est un trajet, je pense c'était 48 heures en total. Et donc, les produits sont arrivés en bon état à la température nécessaire, qui était le -20. Donc, tout était bon pour cette dry run. Donc, le dépôt, c'est ici, c'est central au Yukon, et la distribution, quand le vrai vaccin arrive, la distribution sera d'ici avec les équipes mobiles. Donc, comme décrit dans le plan pour le vaccin, la stratégie de vaccin pour Yukon, on va voir des équipes mobiles pour aller dans toutes les collectivités avec le vaccin. Et donc, ce serait très important pour non juste pour préparer les équipes avec la formation nécessaire, tous les logistiques, la calendrier précis, mais aussi pour la collectivité, pour chaque communauté d'être préparée pour recevoir le vaccin les jours qu'ils arrivent. Donc, tout est planifié comme décrit dans la stratégie, et il y aura encore des détails sur les dates pour chaque collectivité dans l'année 21.
Thank you. Avez-vous une autre question, Claudiane?
Ben, en fait, ma question, c'était, elle n'a pas été répondue, donc est-ce qu'il va y avoir une répétition pour la distribution au Yukon dans les villages?
So there will be, will there be a dry run also for the communities to know if the delivery can be done properly for each of these communities?
Non, pas dans le même sens. Donc, c'est plus dans la préparation pour le vaccin. Il y aura, par exemple, des congélateurs mobiles pour aller avec le vaccin. Donc, on va avoir les exercices sûrement pour comment ça marche, comment transporter. Mais je pense que ce ne sera pas actuellement en transport dans les collectivités. Les détails de planning, c'est avec l'équipe d'opération, mais on va revoir tous les détails pour la transportation. Mais encore, le vaccin va aller avec les équipes mobiles, donc ça sera supervisé chaque moment de chaque voyage.
Please, Premier Silver.
Yeah, so just to add that on that, again, we did a tabletop exercise early on as well this year to make sure that the distribution, as we were designing the plan, was well modeled from the flu vaccine, but at the same time took into consideration the increased volumes of the Moderna vaccine that will be distributed. So that tabletop exercise was our dry run in a lot of ways, making sure that we had all of the logistics figured out. We are determining key populations for initial immunizations, which will include high-risk and immunocompromised Yukoners, elders, healthcare professionals, and Yukoners living in those rural communities, and we're well poised and ready for that distribution.
Thank you. I'd like to thank everyone for their time today. There will be no COVID update next week. Our next COVID-19 update will take place the first week in January 2021. Premier Silver and Dr. Hanley have some final words to say.
Thank you, Pat. Yes, I have two things. One, it's important, as I said, that we take a little time to celebrate the season, even for our leaders. As you know, the Premier and I have worked closely over the last few months, with me mostly providing the advice and with him making many of the tough decisions based on that advice. Now, mask wearing is not only the norm, it's clear that masks are rapidly becoming a fashion accessory or a vehicle for demonstrating a cause. So in the spirit of Christmas,
Uh-oh.
I'm offering the Premier a more festive mask. Now, the Premier has a choice. I think most would agree that he is a kind and generous person like Santa and has had occasion in the midst of restrictions to be able to offer benefits and compensations to Yukoners. On the other hand, like a Christmas elf, the Premier has been hard at work every day, serving the people in the time of need. So, Premier, you choose one. I will gladly choose the other as we take our leave.
I tell you, okay, well, thank you for the gift, Dr. Hanley. I've been getting lots of compliments on my mask, so I guess it's not an option to keep my mask. So what I'll do is I'll ask Adam, who's behind the camera, who's been with us with the sound crew from day one. It's your choice, my friend. Which one do I wear?
The elf.
The elf. Thanks, Adam. I thought we were friends.
There may be a little role reversal going on here. But we also have an additional feature, and I've been criticized for being too poetic at times with my words, but with no apology whatsoever, I bring you a poem for the season. And I've asked the Premier to read this with me. Now, this poem is an adaptation not only from the original poem, A Night Before Christmas, by Clement Clark Moore, published in 1823, but is adapted from another adaptation. A woman from Manitoba with deep family connections to Yukon wrote this as a tribute to her own mother's tireless history of writing poetic Christmas letters, but also to the values that we can be learning from this COVID experience. With gratitude, therefore, to Anne Thompson from Manitoba, and with a few tweaks to give this a more of a Yukon feel, here we go. And I'll begin with the first verse and we'll alternate. "'Twas just days before Christmas, and all through the town, the people wore masks to cover their frown. The virus stood still, just for the time being, but there was no foreseeing what Corona would be bringing. There's no reason to be merry. The borders were closed. Visits to family are strictly opposed.
But how can we celebrate Christmas, they said. No parties, no carols, no more than 10 friends. Is there even a reason to decorate, to put up a tree, or to get out of bed?
Yet others cried out with a similar force, I really don't see a need to change course. I'll keep on my way and plan my celebrations. With friends aplenty, I'll enjoy my libations.
The public health workers didn't have much to say. They were busy throughout night and day. They toiled long hours behind gowns and masks, while others rejoiced. They carried on with their tasks.
All over Yukon, people thought long and hard. What really made Christmas? What set it apart? Could COVID end Christmas? Would tradition be broken? Was there more to this season than baubles and tokens?
They realized at last that they had a rare chance to reset the clock, reconsider their stance. It was time to explore different options and choices of respecting tradition while hearing new voices.
They grew closer together, played games in the snow, made popcorn, baked shortbread, ate meals by candle glow, shared stories and memories, recalled Christmases past, reminded each other of values that last. Not all hope was lost, end was in sight. They knew this Christmas may be different, but that was all right.
They avoided temptations of excess and greed, shopped local, mailed presents, gathered under the tree. They reached out to others in less fortunate states. They made sure they were warm and had food on their plate. They were thankful for mute as they caroled on Zoom, joined virtual worship and in their own living room.
And they found as they searched for a safe way to be, that what actually mattered was completely set free. Family, connection, reaching out and compassion can be reimagined, adapted, refashioned. For love finds a way, no matter the plight. Light a candle in darkness. Help spread the light. Thank you. Thank you, Mr. Premier, for being a sport.
Merry Christmas and happy holidays to you and to Mary.
Same to you all.